Assalamu alaikum everyone, welcome to my channel Medical Lectures and Mnemonics. Today I'm going to talk about anesthesia. So first I'm going to define anesthesia. Here you can see the definition. Anesthesia is a state of control, temporary loss of sensation or awareness. So here in this definition there are four words. The first is the control. So anesthesia is under control of you. You can easily reverse whenever you want. The other is temporary. Anesthesia is induced for a temporary period of time and you can easily reverse whenever you want. The other is loss of sensation. The loss of sensation include the loss of pain sensation, the loss of temperature sensation, and the loss of proprioception. So the other is awareness. So anesthesia is a state of control, temporary loss of sensation, and awareness. So anesthesia may be done for to produce analgesia, for surgical process. The other it may be done for paralysis, for example, during intubation. The other is amnesia, which is the anesthesia bring about for the purposes of loss of memory, and the other is unconsciousness. So the person in which anesthesia is induced is said to be anesthetized. So, what is the purpose of anesthesia? The purpose of anesthesia is to enable the painless performance of medical procedure. For example, when you are going to operate a person, you have to anesthetize the person first, then you will do the operation. So, this anesthesia enable the painless performance of medical procedure like surgery. Now, the types of anesthesia, there are two types of anesthesia. One is the general anesthesia, the other is regional or local anesthesia. In general anesthesia, the anesthesiologist actually suppress the CNS, which cause the unconsciousness and lack of sensation. So this is used for most surgical processes. The other is regional or local anesthesia. In regional or local anesthesia, the anesthesiologist actually block the nerve impulse transmission from a specific part of the body. So, for example, during hair transplant or eye anesthesia. So, the drug which are used in anesthesia include the general anesthetics and the local anesthetics. General anesthetics are used for inducing the general anesthesia, while the local anesthetics are used for inducing the local anesthesia. So the rest of the drug mostly used for during general anesthetic, and these drugs are called anesthetic adjuncts. For example, drugs used for post-operative nausea and vomiting, the drugs for analgesia and neuromuscular blocking agents, and anti-acid drugs, and anti-anxiety medication like benzodiazepine. So these are the drugs used during general anesthesia. So in order to produce anesthesia, there are three phases. The first is the induction, the second is maintenance, and the third is the recovery. So these three phases are required to produce anesthesia. So this was all about an anesthesia. In the next video, I will upload a lecture on the drugs which are used for general anesthesia and local anesthesia. So thanks for watching.